Yeah, hello, Wikimania Stockholm from San Francisco.
Everyone? Do we have? So maybe you can come.
We can move over all one chair so nobody's falling off the end of the table.
Yeah, and I will shift the camera towards, so you can see all the panelists. Okay.
Are you guys sit here?
No, I'm gonna just be here. Okay, so now that you've seen Amin, we are actually I'm gonna switch for a second to the presentation, just for a sec, so you all know what to expect. So welcome to the Mike, I know, sorry about that, wait. Hello, everyone. I'm Shani Evenstein, and welcome to the Education in Medicine panel. Just very quickly, what to expect today from this panel. So we're going to do a really short introduction of each other, so you know why these people are here. Although I'm kind of suspecting that you know why they're here. They're all doing educational collaborations that are happening in med school or that are focused on medical content. And then we're going to have a discussion, basically, between peers, and we're hopefully it's something that you'll find useful. And so let's just delve into it, I would say. And we'll begin with meeting our panelists. So this is Amin, and I'm actually going to switch. There are slides. Oh, I would mention that in the submission page on the wiki, there's a link to these slides, so you can see the details of people. Whoever is not there will add their name to the slides, and feel free to add comments to the slides as we go. It's an editing thing. It's open to everyone. So I'm going to switch so you can actually see Amin almost in the flesh, right? As close as we can. Okay, Amin, do you want to introduce yourself?
Hi, everyone from San Francisco. My name is Amin Azam. I am a faculty member at the University of California, San Francisco School of Medicine. And I've had the great privilege of doing Wikipedia editing in medical schools for about 5 years now. Shani, I think we're going to skip our slides. We're just doing intros now. Is that right?
Yeah, sure.
Okay. So, yeah, I'm super thrilled to be there. I apologize that I can't be there in person. But I'm looking forward to hearing about all the other educational success stories that other panelists have done. And I'm watching from the corner. I can see my slide up. So I started this work in 2013 at the University of California, San Francisco School of Medicine. Next. I think it should just, let's see. Go ahead and advance the slide, should you? Yep. So what was exciting for me about this work initially was just that the university saw interest in it, being the first medical school to do this in the United States. Next. And what I have been doing more recently, encouraging other health professional schools to do this work. Next. And you can see that I have had the privilege of helping shepherd a number of other health professional schools, mostly in the United States through the Wiki Education platform, but there are several other schools from other countries. You can see some of the professions listed that I've had the privilege of partnering with. Next. And collectively, those students from those schools that I've had the privilege of partnering with have done that kind of work. I think I'll stop there.
Okay, awesome. So next is Lane, just because he's on the slides.
How do you do? My name's Lane Raspberry. I'm Wikimedian in residence at the School of Data Science at the University of Virginia. And
Woohoo!
In that role, I share information from the university in Wikimedia Projects. Not only my host university, but I also visit a lot of other universities and medical schools and assist any school that wants to, any class that wants to, in sharing their content in Wikimedia Projects. So the benefit of doing this is distribution and dissemination. Schools are a sort of nonprofit and public benefit organization, and to the extent that any organization wants to share information to educate the public, Wikipedia is an excellent channel by means of which to do this. The usual way that this is done is in the way that Dr. Amin Azam just described. So a school can arrange either for its staff or even better for students to contribute to Wikipedia. There's tracking systems in Wikipedia where people can see how many articles were edited and what people added it exactly. And then also track the number of people, audience out in the world who have actually read this content. I'm going to describe briefly something that I do at my school that's a bit different, Wiki for Research. Next slide, please. So my school, and any other school, so previously a lot of schools think about Wikipedia for marketing and branding. I'm not going to say that we quite do that, but we are moving our research into Wikidata in a certain way, every research publication. This isn't just about my school, this is about the Wiki movement in general. We're collecting citations or a library catalog in a project called WikiCite. So any institution can move the list of its publications and the list of its faculty into Wikimedia Projects. Most schools start with their medical content because that's so structured in PubMed. And what you can see here is you can type in the name of a school, and then you can get a list of all the faculty, for example, who have ever published a medical paper, and the list of every medical paper published by any faculty person. And you can also profile to see what kind of medical research is happening at a given school. So I'm expecting that this is going to be a big trend in the wiki world. It's starting right now and it's going to be ongoing for the future.
Awesome. Can I do one thing unexpected and ask Ole to join us in the panel? Awesome. So these are the type of cool things that happen when you come to Wikimedia, right? You learn about new initiatives, new people doing things, and Ole. We've just met him yesterday. He's from Sweden, and he'll introduce himself in a second, but he belongs in this panel as well. And I'm going to move, in the meantime, Ole, come here there's a spot here. Yes.
I didn't see one.
And I'm going to, Doc James, please introduce yourself.
Certainly. So I'm James Hyman. I'm an emergency room physician. I am mostly involved with education from the point of view of a long-term Wikipedian who is spending their time reviewing the edits the students are making and helping to guide these very new editors in the world of Wikipedia. Amin Azam is one of the recruits I'm most proud of, since we started working together 6 years ago. But I've been involved in a number of educational efforts with a number of folks in a number of countries, more from the guiding perspective of things.
Thank you. Next, we'll give Ole a chance to introduce himself.
Okay, so I'm an associate professor at Uppsala University, and I teach about 80 PhD students in medicine every year in how to contribute to Wikipedia as part of the introductory course as becoming researchers. So this is a toolbox I give them, and I let them know, because I start my lectures by asking them how many of them actually have patients, and how many of those patients go to the internet to read information, and how many of those actually go to reliable sources. And in the beginning, you have 40 hands being raised, and in the end, you have 5 pages or 5 hands raised. And then I say, I'm going to give you the tools in order to fix Wikipedia. So next time you meet a patient, you can start on the same level, understanding the same things. And you will save 5 minutes per patient if you make sure that the subject that you are dealing with and the diseases you're dealing with are actually correct.
And we're so happy to have met you. Next, Susanna.
Hi everyone, I am Susanna from Armenia. I am interested in content on education on Wikipedia, and I was inspired by Shani's course in Tel Aviv University, and was thinking to have reliable content in Armenian Wikipedia. And I take the chance when Shani was in Yerevan. We invited Shani to our medical state university, and from that, still then we have several events, 3 days, 5 days, and even camp for medical students. and it helps a lot. But we settled medical counsel from students to be responsible to that content and to go forward themselves without me. We will see, but now I am engaged.
Yes, and there's an actual wiki club in Armenia because of that, dedicated to health. So
Yeah,
that's awesome.
Awesome. Thank you.
Thank you. Hashemite University representative.
Thank you very much.
Musab.
Hello everyone, my name is Musab. I am a final year medical student at the Hashemite University in Jordan. My work in education is basically in recruiting medical and pharmacy and medical field in general student to contribute to Wikipedia. So what I have done is I established a wiki club inside my university. Basically was like the nucleus of that club was the pharmacy student. So we extracted the WHO list of essential medications that are not in Arabic. It was more than 200, maybe 50 articles. And we started translating them, and we now finished translated like maybe 2 months ago. Every single WHO list of essential medicine article is now present in Arabic. Total article that we have translated since we started in 2015 is around 2,000 articles. Most of them are medical articles, and also we have added around 7 million bytes to our big Wikipedia. We have around 18 faculties working with us at the campus, medical faculties and engineering as well, IT, and many different faculties. Almost every faculty is there, it has students working with us, and we expanded also outside the university campus now. We are working with two schools like 7th grade and also 11th grade. In addition to that, we established a corner for Wikipedia inside our campus. So now we have a physical building for Wikipedia that student can go. We are about to do an opening ceremony for this campus. Thank you very much.
Thank you, and almost last but not least, Marilee.
Hello, I am Marilee Prophet, and I work for OCLC, which is a global nonprofit organization that works with libraries and delivers services to libraries. I'm speaking on behalf of my colleagues who work for Web Junction, which has been part of OCLC since 2003. Web Junction was initially funded by the Bill and Melinda Gates Foundation and now is funded by contributions given primarily from US state libraries to help underwrite online continuing education for people in public libraries. So I'm speaking very much from the perspective of US public libraries, but public libraries in the United States and perhaps also in your environment play a really important role in communities, frequently rural communities, communities that don't have a lot of connectivity otherwise. So libraries really help to address issues around digital divide and access to information for people who are otherwise perhaps quite disempowered. So I think I come from kind of a different perspective than people who are dealing with the medical community or the scholarly publishing community. So Web Junction has since 2003 done online training and continuing education for over 80,000 librarians in the United States, providing in-depth courses that help them extend their knowledge. And I'll be speaking to a program that OCLC is doing that is in collaboration with the US National Library of Medicine through the National Library Medical Network. I'm getting that wrong, but that's the name of the program. There's a network of libraries, public libraries in the United States that work with the National Library of Medicine, and we have received funding through NLM to give a 4-session online course on Wikipedia for librarians that's really focused on helping them understand and interpret what's behind the Wikipedia articles that have to do with health information so that they can then help their patrons understand the health information. And this is part of an ongoing project that OCLC has called Health Happens in Libraries, which ranges from things with having people understand how to deal with their medical insurance, the opioid, how libraries are responding to the opioid crisis in the United States, and a whole range of topics. So this is a long, ongoing program that OCLC has invested in alongside funders and other partners like the Library of Medicine.
Yes, and thank you for noting that it is different, and it's exactly why I wanted you on this panel, because I don't know if you've noticed by now, but the panelists are quite varied, not only in terms of where they come from in the world, but also in terms of who they are professionally. Some of them are actual doctors, like Dr. James. Some of them are PhD researchers or researchers in general, lecturers, faculty, Wikimedians in resident, medical students, and library people, and people like me who are educators, and maybe that's a good time to say something about what I do at Tel Aviv University. But at 2013, I opened an elective course for the Israeli medical program at Sackler School of Medicine at Tel Aviv University. It's a unique school. We have a few medical programs there. I actually happen to work for the American program, but I actually created this course for the Israeli students on campus, and they have 7-year medical program, and and they have elective courses that they need to take. So at 2013, I was simply at the right place at the right time. They were looking for ways to kind of diversify the elective courses that they were offering students, and I said, hey, so why don't you give them a course about Wikipedia? And they told me, okay, go for it, create a curriculum, and we'll ask the committee, the Academic Affairs Committee, if they agree to give it, and it was approved. And so for 6 years now, I've been running this course, a small elective course, right, for medical students. Very, very, I would say, humble course. I didn't have many aspirations for it. It was an experimental thing. I'm not a doctor, so I completely didn't know if it's going to work. But it did, and my student ended up writing, to date, almost 10% of all the content on Hebrew Wikipedia, which is awesome, an awesome impact for just one academic course, I would say. And there's a special emphasis in my course on, and we've talked about it, I've mentioned it yesterday, if you've been to the health space, I'm doing a specific focus on women's health. When I started out, there wasn't even a category in Hebrew Wikipedia for women's health. Although there's a lot of material in English, and it's quite well, as we saw yesterday, in English, we didn't have anything in Hebrew. So it was literally in my course that we opened a category and started populating it, and today we have, I would say, almost 100 articles about women's health. So it's again, small, but it's a progress, and I want to stress this just because I think what I was aiming for with this very diverse panel is to show you that there are many different ways to go about it. There is not just one way to collaborate and do things to improve medical content in Wikipedia. We know it's hugely important, despite the decrease, right, in numbers of readers that James showed us yesterday. It's still important, and we still have millions of people coming to look for the content. So we still do need to make an effort to make this content high quality and available to the public in an accessible way. And so these efforts are trying to kind of demonstrate different and diverse ways of going about it. So you don't have to necessarily be a doctor to do it. And you can be a medical student, you can be a Wikimedian resident, and hey, you can be a librarian. And you can still collaborate. And that's the whole idea of this panel. So I would just go next to, we should have had Martin. I don't know where Martin is, but yeah. So these are some of the discussion points that I wanted to kind of raise with panelists, and feel free to go for it. We have 2 mics. I'll give you another one. And the first question that I want to ask is, how did you get started? So what prompted you opening this program in your school. I told you my story, but what is your story? How did you get started working on medical content? And why do you think it's even important, especially considering our theme for this conference, which is the SDGs? We do have one specifically for health, but still, I want to hear your, why do you think this framework even makes sense for us as Wikimedians? Because all of us are Wikimedians, despite our different areas of work. Why do you think it makes sense to use this framework? So, who wants to go first?
In my case, I had started to approach the PhD students or PhD course takers at the Uppsala University, and I happened to have a cousin who was working as a course administration for the medicine, and he directed me to one of these now just retired but very enthusiastic teachers that thought that this was a super great idea. And when we went in and we started to engage the PhD students, and they actually could see the results from the dashboard showing how much they were contributing and getting out of it, they're just thrilled, and they really like this. So every year they're asking me, oh, please, are you coming back? Please, can't you give this part of the course? And it's really in the toolbox for the medical PhD students at Uppsala University. And we hope we can bring Karolinska Institute, for example, on board, and also being STEP, because we know that they have some reputation in the world when it comes to the medicine. And if their students are doing it, some people will follow. So that's the kind of idea that we take it step by step. But that's how we went into it. And I think that's the strategic part, getting to know the key players and getting them aboard, and then things will happen by themselves.
You were one of the first. You and I opened the courses at the same year without knowing about each other's efforts. How did it start for you?
In my case, the wisdom of my own medical student, because he suggested to me, why are you faculty fighting us on Wikipedia? It's where we all go as medical students first. Why don't you help us make it better? So in my case, it took 9 months to convince the university to be willing to run the course. And I invited Doc James to come and be one of the early adopters to demonstrate the value of health professionals contributing to Wikipedia.
Awesome. Mossab? Oh.
Yeah. Hello. The way that I persuade my university is that we have, like in all university, assignments for student, but the way it goes in Jordan is that most of students copy things from internet without even reading them, and really they just print that and break the copyright laws, and they give it to the instructor who most of the time even don't read it, or if he read it, he will not get benefits from that because it just even copied from internet. And it will end at the end of the day, it will end at his desk in the university. And I say that if we do that on Wikipedia, at least we can assure that we are not breaking any copyright laws. We'll force students to write their own words, to read what they write, and also we can publicize the information rather than being confined in the desk of the instructor. It will be available online for all the Arab-speaking communities. And in addition to that, we asked the university to give some marks for students who write featured articles and contributing to the medical article, in adding resources or any other different ways. Second thing, to persuade the university was that part of all universities in Jordan, in the law, it says that the university has 3 jobs. The first job is education. The second job is scientific research, and the third job is community, services or community help. So the way we address, if you start speaking about education, they will start arguing about the reliability of Wikipedia. So I don't want to go that way because some professors hate Wikipedia. So the way I go to that is, and not also in the scientific research. So the way I go is the community service. I said if we translate our medical articles for the surrounding people and for the Jordanians basically, and then to the Arab world, we will participate in that way to the community services, and also the the university will get credit for, like, it will increase in the classification inside Jordan if it do that. And finally, the university support us by 1,000 Jordanian dinars for annual budget. So we buy certificates, gifts for students. Thank you.
Okay, Susanna?
I was thinking about educational content, and I was thinking if we have educational content as just advertised to contribute to educational content, it don't work. We need thematic concentration, because if you go to Wikipedia on topic, you have to have another topic to jump, and that's why we need some work to do with one thematic content. That's why we started just during the year several events to disseminate this idea, and we have several meetings with authorities of medical university, and we did this. And now we have more than 1,000 medical content, but it is not our aim is more, and we need to have all, not all, that there are 5,000 reliable articles in English Wikipedia. We need to translate all this. That's why we are going forward.
Yes, but you do need to start somewhere, and that's a really good start, so that's awesome.
Thank you.
Lane.
I'm coming to medical schools from first editing Wikipedia medical articles just as a Wikimedian. So I did that for a few years, and then I got a professional appointment as a Wikimedian resident specifically to do outreach to medical schools. This was in New York City. In the area of New York City, there's 14 medical schools. And I went through whatever social networks I could find to contact as many people at these schools. I and another Wikimedian, Dorothy Howard, we sent about 1,500 messages to various people at all these medical schools. Of those 1,500, about 200 replied saying they were interested in hosting a wiki workshop. Of those 200, maybe I had ongoing conversations with about 80 over a period of months. And perhaps about 30 of them actually let us come and present a Wikipedia workshop at these medical schools. So this was only possible in the context of an active Wikimedia chapter in New York City. So as part of a region that had other Wikimedians, ongoing activities that we could connect these people to. So it wouldn't be an isolated Wikimedia event. And then these relationships also took years. No one's going to commit completely at the first event. They want to host a small event and have a conversation, meet people, come to know what is it like to have a partnership with the Wikimedia community. And as it turned out, maybe there's been 5 of these programs that lasted more than 3 years. So sometimes it happens that there's one champion at the school, and for as long as they're there, the Wikimedia program will persist. Sometimes it can also happen that the champion recruits another champion, and then the program becomes persistent. And I wouldn't expect it to happen any other way anywhere in the world. So it starts with a Wikimedian talking to people about it. It depends something on personal relationships, and then people need to become comfortable over time.
Yeah, and thank you, because you're perfectly taking us right to the next question, which is challenges. We all have them. You've just mentioned a few, and so did, I think, Mossab. You also mentioned some issues with the university that made you approach them in one way, not another. Marilee, we kind of skipped you. Do you want to say something before we delve into the difficulties or challenges, rather?
Well, this may go to challenges. So sometimes reframing things is the best way to go. With our project, again, we're quite different in that we're not really trying to exhort people to edit Wikipedia, but trying to understand from a deep research perspective what is going to motivate our population, that is people who work in US public libraries, to interact with Wikipedia. What is their user journey? And we were fortunate to receive funding from the Knight Foundation and also the Wikimedia Foundation to do a training program for US public libraries. The medical program is really It's a mashup of that previous training program along with our deep investment in health information. And what we learned in our research is that librarians aren't necessarily interested in editing Wikipedia. We didn't frame that course. We have not framed any of our courses as a learn to edit Wikipedia, but learn to understand Wikipedia, and then design your own engagement program that makes sense for your local community and for the job that you do as a librarian around the knowledge that you've gained with Wikipedia. So I think that really trying to understand your user community and their perspective rather than approaching this from here's how to edit Wikipedia is really
Crucial.
just a valuable thing to take away from everything. So I think I've really learned a lot from my colleagues who know their audience so deeply and have really respected, despite my enthusiasm for editing Wikipedia, I've really learned a lot from them in they're honoring the profession and honoring people to make the best decisions for themselves. And I think that that's helped make our learners very successful.
Thank you. Amin, I'm quite curious to hear about some of the challenges that you've had over the past 6 years.
I mean, I actually think that the challenge was initially getting it into the curriculum. Once it was in the curriculum, it's become quite easy to run it every year. And the biggest challenge I think I've faced more recent years is the engagement of students remotely as they are on the interview trail. But I use the exact same system you're using now to have me participate. I use these video conference meetings where we share each other's screen. So that way we can continue to support the students, even across large geographic distances.
Any other challenges that you've had now that you're trying to actually scale and, approach more universities and bring more people in?
I mean, I think it's the same point that Lane made earlier. It's very much the personal connections. And so I have had the privilege of talking to people I didn't know, like Lane, not quite the scale that Lane described, but I think it does require that personal connection and to understand the local context and how might you fit into that school's curriculum.
Mm-hmm. Any other comments on that, on challenges?
To speak about challenges when it comes to education, there's sort of two sides to the coin. One side is, how do we go about bringing in larger numbers of schools, larger numbers of students? And then the other side is, how do we make sure that, the community is robust enough, and we have enough engaged Wikipedians who are actively engaging with the students when they come to Wikipedia and giving the students the feedback that they often require. My initial hope when it came to the education projects is, we would recruit students, we'd recruit 100 students, 90 of them would disappear, 10 of them would stick around, and the 10 that stuck around would then provide support for, the next group of students that come on board. We unfortunately haven't seen that degree of retention. And we do have programs like WikiEd that provide support for education programs and provide some hands-on support to the students themselves. And then of course we have Wiki Project Med Foundation who provides support for the students themselves. But Wiki Project Med Foundation is fairly small. The group of active editors is fairly small. My question is, how do we scale, the support that these students need? We have some amazing folks like Jennifer Dawson, who Cochrane has hired and who is providing a great deal of support to a number of students. And that has worked really well, but we also need to keep into account that, if the number of students tomorrow was to increase 10-fold or 100-fold, that might not necessarily be a good thing unless we can, also put in place the on Wikipedia supports from established people who understand, who can help guide the students with respect to, the manual style and do the copy editing and, guide them with respect to what references are preferential for this sort of source, as Stuart Ray spoke about the other day. So that's just my one comment and one thing we need to keep in mind as we work to expand these efforts.
Yeah, I would add that one more angle of it are the students themselves. So besides faculty and beside the community, the third, if it's like a triangle of connections, then another tip of it would be the students. And engaging students is a challenge as well that we need to take into consideration. And I think especially in electives like Amin and mine, where it's not just a workshop, right? It's not a one-time thing. You really need to think hard about how you actually build a curriculum that is interesting, that is engaging, that it's not too boring, that it's not too technical, right? Because wiki editing could be done in a very technical way. So a lot of thought, at least mine, on my end, always goes to, and I see Amin nodding behind, but yeah, a lot of thought is being put into how do I construct sessions that are actually interesting to students. In some, and even though I'm doing it 6 years now, it's going to be the 7th year this coming October. I don't have a magic solution. I mean, it's every year I change the curriculum based on feedback that I get from students. I try to be as engaging as I can, but it's always a process. And every year I rethink it and I reiterate like I change the course, I change the curriculum. I'm trying new things, and so it's always a work in progress in a sense. I would say though that one of the things that have helped my students, so some of the technical things for me at the beginning was what to work on. How do we choose, even small things, like how do students choose the subject to work on? So for you, Ole, I know it's a non-issue because, you know, they have their PhD topic and that would be what they gravitate towards. But when you have students, either it could be fourth-year students, right, advanced like Amin, or first-year students like mine who have, you know, they just got to med school. They have no idea what they're doing or what they're interested in. And you need to kind of find a way for them to know what to work on. So one thing that was really, two things were helpful. One is choosing a theme. And I did that like 3 years ago and decided, hey, we're going to do something in the topic of women's health. And we're all going to invest in it, and this is why. And I explain about the gender gap, and I explain why it's important, and that would be their first interaction, and they learn as they go when they write it. But then for the second one, I open it up, and they can choose whatever they want. And that was, when I did that, there was an issue, because many of the students, like we wasted a lot of time at the beginning, just of students not knowing what to choose, which is when I started working with lists. So having lists is important, and now we have a tool, or you can use either PATScan or not in another language is the tool that I'm using. I'm using English Wikipedia category for simply the wider one, right? The top for health topics, and the students can go through it and choose whatever is interesting that doesn't exist in Hebrew. So having the right tools and having lists to direct students is helpful, but I will always, not force them. I will, especially because I do force them kinda to work on women's health at the beginning. I do open it up to subject that they're interested in, that they care about, that they want to work in, and if it's not on the list, which I've had some cases where it's not, then by all means, because it's important to give them something that they really are passionate about. And many of them are, sons or daughters of doctors, and their family is interested in like really groundbreaking research or something really new, and they really want to work only on that. So I would not say no to that. As long as they have references and resources, that's good enough. Any comments on that?
Yeah. So the first challenge for us was that in Middle East the decision making is so centralized. So if you want to speak about Wikipedia like inside the campus, you need to have a permission. So I started talking with professors about that, and they allow me to go to the classes and speak with the student. But it was like you are not speaking to the target population. You are like shouting in a hall, and you don't know who is the interested. So you could imagine that I start just by one student, and I still remember her name. Her name is Nama Mansour. She's a pharmaceutical sciences student, and we start from there. But the second challenge was that when I was invited to the Dean Council to speak about how to implement Wikipedia on all the university faculties. So I spoke for 20 minutes, but after that, the Dean Councils, which is the supreme power inside the university, give us a decision to let us talk freely to the students, and also to accept all our activities inside the campus, and asking the faculties to nominate the most interested students for writing Wikipedia. So at that point we reached to the target audience, but that put large burden on me, because I was alone and I need to revise articles for around 12 faculties in different student. So I remember that I revised more than 120 articles, and that was not just in medicine, even in engineering, in IT, in every different faculty. But at that time I was at point that I should persuade the university that my project is successful. So I need to work hard, and to be honest, also my average at the university goes down because I do Wikipedia stuff more than study at that point. But we made the job. Yeah, and the third challenge was for students themselves. Sometimes they say, why should I write on Wikipedia? So we should attract them to that. And the way we do that, to be honest, is by giving them marks because they want. They want some marks. So we persuade the university to change the laws for the regulations for giving marks, and to make Wikipedia as accepted method of giving student marks for what they do. So that's it. Thank you very much.
Thank you. So we have to kind of wrap up, but I do want to end with one good thing that you always find yourself doing your courses or your initiatives, kind of as a giveaway or a good tip that you can give to someone who wants to start something like that, something that you keep doing that works for you.
I would say really invest in giving people the basic appreciation of the wonder that is Wikipedia, how it's constructed, how it's maintained. Really lavish some time on that, and don't go straight for that edit button. I think, people will fall in love if they understand that Wikipedia is constructed of community and that resonates with their own values.
Thank you. Lane.
Show the page view metrics. Show the graph that shows how many people out in the world are actually reading their content. When you show people that, then they become convinced of the value of it.
I totally agree with him, but also I would add that reach to the target audience, reach to the interested people, let them know how they can contribute to the human knowledge, and that's it.
I was inspired by Wikipedia in education, and I will show them what they get editing Wikipedia. They will enlarge their knowledge and
skills.
Many abilities. Yeah.
Many skills, yeah.
Yeah, skills, especially students. I like Wikipedia, and I encourage all my environment to contribute to Wikipedia, to have best ever encyclopedia.
It's key to make sure before you bring someone, it's key to make sure that before you bring a class of students to Wikipedia, that you engage with the already existing communities of Wikipedia that you're going to be interacting with. Yes. Introduce yourself. You as the leader of this group of students, stay involved with the communities so that everybody's aware regarding what's going on, and that'll make everything go more smoothly.
So a couple of tips. The first one deals with these, where do I start? And when I take my researchers, sometimes they also ask that question. And then I ask them to write down 3 to 5 keywords describing the research, starting with those articles, and then 2 minutes later they're on editing because they read their pages and they see that that's not as it should be. And the other thing I do is that by the end of my courses, I go through the edits that the students have done. So each and every time I need to make a new effort reading through all their edits. But it helps me to point to what has been successful, what has been the problems, how has the community responded, and it really engages with the students because students are there in the class and they say, and hey James, what did you do? And this is your edit? Yeah, that's right. And how are you thinking about it? And the rest of the class, they learn from the mistakes you did, but they also appreciate that the community is there to support them and that it really gets engagement in the class. And I think by ending by that, it's like that we have the whole room feels really engaged when we leave and that they are seen as individuals that have been contributing and that the community is really appreciating what they're doing.
Mm-hmm. Amin?
Encourage students to peer review each other's work. And then also I would just add, share your passion for the work because when they see that you're passionate as an educator, they also get excited about the work.
Yeah.
And Shani, wrap it up for us.
Yes, actually I second everything you said. These are all excellent tips and I was going to say peer reviewing before Amin, so you stole mine. But no, if I have to say one more thing, I would stress again the passion for it because I think it's contagious. So if you're able to kind of infect, I'm sorry for using such words, right? Like infecting people. But yes, you kind of do need to infect your students with enthusiasm. And if you succeed to do that, everything will kind of fall into place. So try it out, and we're all here to support you. And I want to thank all my panelists, and especially Amin for waking up at 3 a.m., oh my gosh, to be with us. Thank you so much. Enjoy lunch.